nowadays, especially youth facing diabetes? What are the main reasons behind that? So, present we are with Dr. Quayyum Quadri, General Physician from Best Orthopedic Multispeciality Germanten Hospital, Attapur, Hyderabad. Hello, sir.
Yeah, hello.
How are you, sir?
Fine.
Sir, nowadays lot of people are facing the issue diabetes.
Yes.
Actually, we can see this problem mostly in the youth.
Yeah.
So, what is the main reason, sir, behind that?
Well, diabetes has taken an epidemic proportion in India, especially it's not more increasing in younger population also. Basically, diabetes is of two types. There's type 1 diabetes and type 2 diabetes. In type 1 diabetes, usually it starts early in the age, like during childhood, and most of the patients are insulin dependent. In type 2 diabetes, it starts late in the life, like after 40, but now the trend has changed. It's occurring in the younger individuals as well. All this is because of the environmental factors, stressful life, and dietary habits, lifestyles. People have stopped doing exercises, more sedentary lifestyle, and even the diet, the food they are taking is junk food, and actually it's overeating and malnourishment that also leads to diabetes.
Okay. Sir, lot of people says that if you consume more sugar, then we will get diabetes. Is a myth or it is a fact, sir?
It's not just sugar. You have to take a balanced diet of carbohydrates, fats, and proteins. All have to be in a balanced proportion. If you don't take a balanced diet, and other than that, if you overeat and don't burn what you are consuming by way of exercise or physical activity, then over a period of time, you develop diabetes.
Is there any symptoms that we are getting diabetes?
The cardinal symptoms of diabetes is polyuria, polyphagia, and polydipsia. That is, people get more hungry, they take lot of food, but they lose weight. And if there is increased frequency of urination, they more than a normal person, they produce urine and they pass urine more number of times. Since they lose water through urine, they develop thirst more frequently, and they need to consume lot of water. So these are the main cardinal symptoms. Apart from that, because the immunity gets lowered, they easily acquire fungal infections. So they may get skin lesions, pruritus. Okay. So these are the main symptoms of diabetes.
Sir, we can cure diabetes or we can control the diabetes, sir.
Well, diabetes is a systemic disease, and mostly it can be controlled. But sometimes, early in the course of the disease, if you correct your lifestyle, if you modify your lifestyle and use a healthy lifestyle like diet control, good physical activity and exercise, and probably in early stages, it can get reversed.
Okay. What is the treatment for diabetes, sir? If it is in the starting stage or severe stage?
Yeah. The first dictum of treatment is lifestyle modifications. You have to take a balanced diet, have control on carbohydrate intake, and uh, exercise. Physical activity is the most important thing that one should follow. You should at least do an hour or so of brisk walking daily, and diet control. Okay. So these are the things which help in controlling your blood sugar levels.
Okay. What are the precautions that diabetes patient should take, sir?
Diabetics are prone to get infections, and once they get an injury or wound, if they don't take proper care of that the healing process is delayed in diabetics. So they have to take lot of precautions. They have to, and they develop if they develop complications like peripheral neuropathy, that is the blunting of sensations. So they don't get proper sensation. So one injury happens, they ignore it, and that take a proportion or size of like an ulcer which is non-healing, or wounds which are non-healing. So they have to be very careful. They have to use protective shoes, and most important thing is keeping the sugar under control. If they don't keep sugar under control, then complications will happen. The eyes may get affected, the kidneys may get affected, the blood vessels may get affected, which leads to heart disease or diseases in the peripheral vessels, like they may get gangrene of toes. Like these are the complications that may get if they don't keep sugar under control.
Okay. So for diabetes patient, is there any diet to follow, sir?
Most important thing is you have to take or avoid carbohydrates in the form of fine sugars, um any sweets or fruits which have high glycemic index or which have more carbohydrate levels in them, especially bananas, sapota, grapes. So these are the things one has to avoid.
Okay, sir. Well explained about diabetes. Thank you, sir.
Welcome.